In our last video, we talked about how sometimes when there's pain with a certain type of movement, a lot of people the tendency is to avoid using that joint or that body part because it hurts. And we talked about how that's not a great way to solve the problem. So what I want to do today is just talk about some things you could do for individual joints and how we can start to maybe improve that function. So keep in mind, again, we're not necessarily looking for ways to eliminate pain. We're looking for ways to improve the way the joint functions despite pain. So to start with, we'll talk about the knee. So with the knee, there's kind of basic range of motion with the knee. The knee can straighten, the knee can bend, and there's also a little bit of rotation within the knee. So to start off, anytime you have a painful joint, usually the first step is to start off with working on your mobility. So with the knee, we've got some pretty simple exercises. The first one is an exercise just to help to improve the extension of the knee or your ability to straighten the knee out. So one simple thing you can do is sitting in a chair, just prop your foot up on another chair or coffee table, sitting on the floor, putting a yoga block under your foot, and just allowing yourself to relax the muscles behind the back of the knee and let the gravity just kind of pull that knee down into a full extension. Now, this can be quite uncomfortable depending on how much pain you experience or the diagnosis that's affecting the knee. So you don't have to hold it for very long. The idea is to try to relax as much as you can, let gravity straighten out. After about maybe 15 to 30 seconds, then you can just kind of pick the knee up, take it out of that position, give it a second to rest, and then put it back up there again. And what you should find is each time it gets a little bit easier to allow the knee to straighten out a little bit more. The goal is to get to the point where the knee gets fully straight. Now, that might not happen in one session. It may take several weeks to get there, but consistently working on it will make a big difference. The other exercise is to work on the rotation of the knee. So this one, you can kind of sit with the knee just slightly bent. And what I'm going to do is just try to simply turn my foot side to side. The only thing to be aware of on this one is to make sure that when you're turning your foot and trying to rotate the knee, that you're not rotating your whole leg. You want it to happen just from the knee down. So I'm going to put my hands on my thigh just to kind of keep it from moving. And then I'm just going to turn my foot in and out. And there's not a lot of range of motion there, but it's just going to start to get that knee moving. And you can see I'm holding it for a second or two, trying to pull it over as far as I can get it to go. And you just do several of them, looking to see if you can get a little bit more range of motion with each one, or maybe a little bit less pain in the range that you have. And then the last mobility exercise, normally we're all familiar with how to stretch out the quadricep muscle, which is just to grab the foot and pull the leg back. But if you have a real painful knee, it may be difficult to bring the knee up to that point so you can grab a hold of the foot. So using a towel, a belt, this happens to be a yoga strap, you can use something like that to wrap it around the bottom of the ankle. That way you can pull it up just enough to where it feels comfortable, and then from there, gradually pulling it up until you start to feel some of that discomfort, and then again, you hold that for an extended period. I usually recommend 15 to 20 seconds. After that, you would let that down and let it relax, and then you would repeat it. Again, enough times to feel like you're beginning to feel an increase in that range of motion, or maybe a little bit less pain at that same range of motion. And again, it may take consistency of doing these exercises on a regular basis in order to really see some improvement in that range of motion. But improving your range of motion is always the first step when you have a joint that has begun to lose some of that function or some of that range of motion. The next step would be to start to work on building some strength around the muscles. Now, this is where it starts to get a little tricky because it's easy to overdo strengthening exercises. So once again, we can start with just some very basic exercises, just to simply start to engage the muscles around the knee and to start to improve your tolerance for using those muscles. So the most basic and simple exercise, once again, would be to sit with the leg out flat. Now, in this case, I have it stretched out over across the chairs, but you could do this sitting on the floor, sitting on the bed, or even sitting on the couch, so there's a little bit of support behind the knee, if that helps to make it more comfortable. And the simplest way to do this is just simply think about flexing or tightening the muscle on your thigh. So I'm just going to squeeze that muscle as tight as I can. I'm not too worried about pain. I expect to feel some pain with that. I'm going to hold that for 5 to 10 seconds, and I would do that several times to start to get used to squeezing and flexing that muscle. You should notice that over time, as you do it, the same level of discomfort should be getting progressively less, and it should feel like you can get a stronger muscle contraction. So this would be, again, sort of a simple way of just beginning to get that muscle firing to help to improve the function of that joint. Over time, you would gradually increase the difficulty of the exercise, eventually leading up to where you could even do squats. Now, keep in mind that when we start doing something like a squat, we start off with a smaller range of motion just to get used to the movement and gradually progress to where you go deeper into the squat and maybe eventually gradually progressing to where you can add a little bit of weight and resistance in order to improve some real strength in the joint.